TV Public Affairs presentation.
There are no easy jobs in the BC Cabinet. But for Minister Judy Darcy, the measurement that she's going to be judged on is actually reducing deaths by drug overdoses and as a result of mental health problems. There is no tougher assignment when the front page is going to tell you whether you did your job or not, and the results are tragic if you didn't.
Well, good evening and welcome to Voice of BC. I'm Bon Palmer, and I'm delighted that Canada's first ever anywhere Minister of Mental Health and Addictions is on the show. Judy Darcy, welcome.
Thank you so much. Thank you.
And we're halfway through the legislature session, and it's a very busy time in Victoria. And if you're watching us live on Thursday this afternoon, Premier John Horgan had a brief media availability, and he's on his way to Ottawa Sunday morning to try to sort out this, what do you want to call it, imbroglio, impasse, showdown, row over the proposed expansion of the Kinder Morgan pipeline. Minister, the Premier said he didn't have much to tell us about it other than that he's an optimist going down there and he hopes we get it sorted out.
Well, John Horgan is an optimist, and you're right, he doesn't know what to expect. He doesn't know. The Prime Minister has asked him to come together with Premier Notley from Alberta for a conversation about this. Doesn't know what to expect. I do know that he remains very firm in his conviction that we need to do everything we possibly can to protect our coast. In the last election, the majority of British Columbians voted for parties that said that they thought that the Kinder Morgan pipeline was a risk to our coastline, a risk to our environment, a risk to our economy, with thousands of jobs potentially impacted if we have a bitumen spill. So, we're resolved that we are going to, continue to stand firm. But what the Premier has said very clearly, what the Environment Minister said very clearly is we think ultimately this question needs to be determined in the courts. We're planning to refer the issue to the courts, and we've asked the federal government and the Alberta government to join us in that referral.
Yeah, the Premier was asked again today, and just to repeat it, it was asked that the government plan is to ask the courts how far the province can go in regulating the pipeline, the shipment of bitumen through the province, and they're just going to ask the question because it's, as far as the province is concerned, not clear. Premier was asked today whether he would stand down that legal action in order to get a settlement here, and he said no. Province has a right to go to court, and we're in court, and that's how you settle things in a democracy. So it doesn't sound like he's going to back down on that, but very hard to figure out what else Ottawa is going to do. So I guess we have to wait till Sunday and find out.
I think we will have to wait and see.
Yeah. The other thing is we passed the halfway mark in the legislature session this week, and as we always are when the legislature is about halfway through, we're starting to look at the workload of what's left and what we've done, and there's still some pretty big stuff coming, including the marijuana legalization legislation and reform for ICBC. 5 weeks left, an awful lot of work to get done.
There is a lot of work to be done, but we are moving along. There were a couple of things that were introduced in the legislature just this week that are very significant, I think. We'd already moved in the fall on some aspects of strengthening rights for tenants, for renters, which is part of our 30-point action plan on affordable housing. And this week, the Minister of Housing, my colleague Selina Robinson, introduced legislation that strengthens the rights of renters that might be affected by rent evictions or by dem evictions, which have become very commonplace, and also strengthening the rights of people who live in manufactured homes. So those are important steps forward in our affordable housing plan. Also, my colleague, the Minister of Labour, introduced some really significant legislation this week, and there were first responders and sheriffs and people from the correction services there in the galleries and also on the front steps, really welcoming this announcement. And this is really about the kind of workplace injury that we don't see for first responders and sheriffs and correctional officers, people who are on the front lines who are keeping us safe every single day and who often are experience mental illness, sometimes trauma that results in mental illness, in post-traumatic stress disorder, and have had to really struggle with WorkSafe to get the protections that they need. So we've now introduced, the Labour Minister introduced changes to legislation that will mean that for people who work on the front lines like they do, first responders, people in corrections, and sheriffs, that if they are dealing with a mental illness related to trauma, that it will be presumed to be caused by their employment. This is, it's sort of a parallel with what's happened with other groups like firefighters, certain types of cancers that are assumed to be related to the work that you do as a firefighter. So, you know, these people are just do heroic work every single day, keeping us safe, and this is really about our government saying we need to take action to help to keep them safe.
And I have to ask you about this. You're the member of the legislature for New Westminster, and what do you get to bring home to New West? A brand new bridge. You've already got. You've only been in since last summer as a government, and $1.4 billion replacement for the Patallo Bridge. Are you going to name it after you?
I don't think so. But it is very good news for New Westminster. I have to tell you that traffic and congestion is probably the #1 issue I've heard about ever since I was elected, since I was running for office. And people just were frankly fed up with a government that treated New Westminster as nothing more than an intersection. We're really at the crossroads of the Lower Mainland. So this bridge will make an enormous difference as far as traffic congestion. But coupled with that are the other transit announcements. So the fact that there are going to be more cars on SkyTrain, the fact that we're going to be, you know, the government is supporting in a very big way, stepped up to the plate for rapid transit in Surrey. That helps to take pressure off the entire Lower Mainland, including all those cars and trucks coming through New Westminster. So yes, our folks were really, really excited about it. And that's not all. We're, you know, a new high school that was announced last year. But certainly
hospitals in the works.
A hospital is in the works, and seismic upgrading. I mean, you know, I can't tell you how many parents have spoken with me over the years about their fears every day about sending their kids to school to learn in schools that are unsafe. So we, Minister Rob Fleming, the Education Minister, joined me for a very important announcement about 2 of our local schools. One that's going to be replaced, Richard McBride, and another that's going to be seismically upgraded. And there were parents in the audience who were weeping. It was really good news. And, you know, there's one announcement after another that comes out of the budget that is making a difference in people's lives every day, like childcare. Yeah. Childcare has been one of certainly a top issue in New Westminster, with people saying, some parents saying to me, you know, when I've talked about it 5 years ago, I said on Twitter, this is often the second highest expense that a family has. And I had young mums or young dads tweeting me and saying, no, this is actually, we have 2 kids. This is our highest expense. So we're investing $1 billion over 3 years, the beginning of a bold and innovative plan for universal childcare. And starting right away, as of this month, some parents will be paying $350 less in childcare costs. That's really significant as far as affordability of daily life.
I should get on to your ministry because it's a very busy ministry and we've got an awful lot of questions on it because it's something new. I will start off with something you were talking to me about before the show went on. And it is true, as Bill Thielman observed, and I think just in terms of the sobering aspect of the ministry, that there is a death toll associated, obviously, especially with the opioids crisis in the province. But you were saying that you think that you also wanted to talk to people about the number of people that are now being saved every day. So do that.
Well, there are 4 people a day on average who are still dying, and every one of those is a tragedy. What those coroner's reports don't tell you is the number of lives that are being saved. And whether it's police I talk to in New Westminster, or firefighters, or ambulance paramedics, or people who work in safe consumption sites, people who work in emergency rooms, there have been thousands of lives saved in the last few years that don't make the headlines. And that's due to the heroic efforts of people on the front line, people who work in healthcare, who work in community social services, people who are first responders. One firefighter told me about a part of Vancouver, and again, it varies city by city, neighborhood by neighborhood. One firefighter told me for every 21 lives lost, for every 21 lives saved, 1 has been lost. Okay. Other police have told me about 6 lives being saved for one lost. Ambulance paramedics have told me stories somewhere in that range as well. So we have, and in emergency rooms as well. So I just want to pay tribute to all of the people, the unsung heroes and heroines out there, who are just giving their all every single day. The overdose crisis is really bad. It's tragic, it's devastating. It would be a lot worse without their magnificent efforts.
You were saying too, and again, before I get to the questions, you know, you follow this problem all over North America, and there's no question we have one of the worst problems, but we're also on the leading edge of dealing with it. You're getting a lot of requests for information from other jurisdictions about, as I say, you're the first minister with this title and these specific responsibilities. Are you getting a lot of inquiries from elsewhere?
We certainly have requests, inquiries from across the country. Certainly when I attended my first federal, provincial, territorial meeting of ministers of health, where the overdose crisis was a major topic of conversation, we were asked by the federal government to be the lead presenters on it, because they really believe that they and the entire country have a lot to learn from what we're doing. And we're hearing from certain places in the United States. Had an inquiry from the New York Times not long ago about the efforts that we're taking. I think we really have been cutting edge, and we are escalating our response, not just every month, not just every week, but every single day. We have to both save lives and to connect people to treatment and recovery as soon as we possibly can.
When the ministry was first announced, one of the first questions was, how do you manage two health ministries? Here's a question about that. Former Cabinet Minister Ida Chong.
Minister, there has been some criticism that the work that you're doing as a separate Minister of Mental Health and Addictions is actually not necessary, that the additional cost of a new ministry and a new minister, in fact, needn't be there, that the work you're doing, in fact, can and should be done under the Ministry of Health. What do you have to say to those critics? Can you point out and itemize two really specific reasons why your ministry needs to remain separate from the Ministry of Health?
There's a concern about siloing too. So how's it going?
Well, it's interesting. The recommendation to create a separate ministry for mental health and addictions came out of a bipartisan committee. It was a unanimous recommendation of the Standing Committee on Child and Youth Mental Health. So but Liberals and New Democrats agreed that this was something that we needed to do. Although the Liberals chose not to do it, we chose to move forward on that. But we work very closely with the Ministry of Health, but this is part of my mandate is twofold. It is to lead the response to the overdose crisis, which previously, frankly, was being done very much off the side of people's desks. It did not have the kind of dedicated focus that our ministry is bringing to it. The second part of my mandate is to build a better system for mental health and addictions care in place of the fragmented, uncoordinated system we have now, which has huge gaps. When I say fragmented and uncoordinated, we deliver mental health and addiction services in many different ways and across many ministries. Of course, the Ministry of Health has the primary role, but we also have the Ministry of Children and Families that deals with child and youth mental health. We have the education system and the Ministry of Education, where we are doing some work, but we absolutely need to do more so that we start early with prevention and early intervention with children in our classrooms. We work very closely with the First Nations Health Authority because both on the overdose crisis, which is affecting Indigenous people at a rate, Indigenous people are dying at a rate 3 times higher than the population at large. So the purpose of having this ministry was really to work across government and also to work with all of our partners to build a seamless and coordinated system where every door is the right door and where you ask once and you get help fast. And I have to tell you that people, both families, members, people with lived experience with mental illness and addiction, as well as people working on the front lines across the province, have welcomed the creation of this ministry, because finally, as Premier Horgan says, and he said the reason for creating this ministry was very simple. So there's one person in cabinet and one ministry in government where when they get up in the morning, what they focus on is mental health and addictions alone, so that it will no longer be the poor cousin of the healthcare system. It will get the kind of focus and the kind of equal treatment that it really needs and deserves.
And you're not finding a lot of turf protection and siloing and problems like that you sometimes see in bureaucracies?
I'm finding an overwhelming desire that we need to fix this system. And, you know, parents and family members are the first ones to tell you, but also people on the front line who are giving their all to try and sort of bring this system together, this fragmented system together, are the first ones to tell you that we need to really transform how our system works. You know, I think of some of the family members I met. I had a roundtable last week of family members who'd lost children due to overdose. It was the most intense meeting I've been involved in since I took this job last July. And those family members all described how they the parents spent every living moment, every day, struggling to keep their children alive. And they would they'd enter one door and it would end up being the wrong door. They'd go to another door, it would end up being the wrong door. And one door after another, you know, education would step up, it would step back. Healthcare would step up, they'd step back. Children and families step up, police step in, step back. But unlike for other illnesses, there's no one responsible for coordinating your care. So it falls to families very often and to those people who work in the system who are really trying to knit it together. So, you know, when I say we need to get to a place where every door is the right door and where you ask once and you get help fast, that's really a key goal of our ministry. And that means bringing people together across government and bringing people together across that diverse system of care that is our mental health and addiction system that has all of these wonderful not-for-profits, community agencies. It's a very diverse sector. We need to knit it together in a coherent way so that we have a system of care. So, you know, when you have cancer, you know who's in charge of your care. You know who's going to follow you on your journey. We don't have that for mental health and addictions. We need that, and our ministry is going to develop the strategy to get us there.
It'll be interesting to see in a few years how many other Canadian jurisdictions follow this model, because what I hear too is there's a lot of interest in what's going on here in British Columbia. It's seen as a lot more than a gimmick, I can tell you that. Let's go to Bill Thielman, the question that those of us in the news media hear a lot. It'd be interesting to hear the minister's answer to this. Here's Bill.
Minister Darcy, one of the most difficult questions that people often ask is, if people are mentally ill and addicted to street drugs that could kill them and are causing harm to themselves and others, why are they not detained and put into treatment programs in a kindly way so that they have some hope of relief rather than continuing a life of misery? It's one of the toughest questions that I ever get asked.
It is a tough question, and it is one of the issues that we're going to look at. We do have a Mental Health Act in British Columbia that under certain conditions allows people to be committed involuntarily for treatment. And there are some folks, you know, who have lost their children due to overdose who are saying that there ought to be a system that applies to committing children, youth, involuntarily. So it's one of the things that we will certainly look at as part of developing a better system for mental health and addictions care. But we need to make absolutely sure that we have put in place all of those voluntary programs that can serve people's needs far better than the current system is serving them. And there are just so many different challenges that we need to overcome. When I listen to parents talk, they will say, you know, when two parents I met with told me that their daughter had been in detox. She was there for several days and she was angry. So she was released from detox because she was angry and she was disruptive. Okay, but there was no one else to take her hand and say, and this is where we're going to get you the support that you need. There are other parents who said to me, my child was in an addiction treatment program, but he was suffering from borderline personality disorder. And so the criteria of that particular treatment program said that this child didn't fit there. Again, it was back to the parents. So we need to make sure that those doors are open. We need to make sure that there really is accountability and responsibility for taking people's hands and guiding them through the system to get the care and the support they need for treatment and recovery. One of the options to look at is the Mental Health Act. We will look at other options, but it needs to be as part of that whole picture. There's no magic bullet.
take a brief break with the Minister on Voice of BC. Stay with us, a lot more important questions for this very important ministry. Stay with us.
Since this government was sworn into power, they have taken the initiative to start addressing the challenges that face the delivery of healthcare services in British Columbia. In particular, there was a bold move to establish a new ministry for mental health and substance use, which is a critical issue for communities across British Columbia. As the union that has many professionals who work with the mental health care team, we're happy to see this initiative take place.
Hi, I'm Todd Stone. Now I want you to sit back down, put your feet up, and don't touch that remote control, because the show is going to be back and it is good.
Where there are no bars, there's freedom. It's where we find the strongest connections. And power we never knew we had. It's not always easy. And sometimes you wonder what you got yourself into. But when the stars are your compass, you tend to find your way.
There are more ways to connect with us at Voice of BC. Email us at vobc@shaw.ca. Follow us on Twitter at Voice of BC. Or like us on Facebook at facebook.com/VOBC on Shaw TV.
From the perspective of the front lines, the overdose crisis is continuing at an astronomical rate that's really continues to be unparalleled, and we are eagerly waiting for the escalated response.
Welcome back to Voice of BC. Talking to British Columbia's Minister of Mental Health and Addictions, and I'm just going to break away from that topic briefly because it's an important day in the whole world today. It's Holocaust Memorial Day, and Minister, you presided at the ceremony here in Victoria, and you had a very interesting story to tell, a gripping one. What is it?
I did. My father was a Jew, born in Russia. He kept his Jewishness a secret after the war because he lost family members in the Holocaust, and he didn't tell anyone about being Jewish, including his children, until a few years before he died. And because he, it's a long story, but he
This is a picture.
That's a picture of my father. That's a picture of my father. There he is. There he is. He moved to France in 19. That's me with a beehive right in the middle in Sarnia, Ontario. My father's family moved from Russia to France. He served as a captain in the French army. He was captured at Dunkirk. 350,000 people were rescued. He was one of the people left behind and was taken prisoner of war. He managed to keep his Jewishness a secret when he was in a prisoner of war camp because he was married to a French woman at the time, Jeanne Hélène. She sent him letters loaded with Catholicisms, little Catholic medals enclosed, and he managed to survive the prisoner of war camp without them discovering he was a Jew. He was released on some agreement with the International Red Cross, went back to Paris, occupied Paris. He encouraged his father to go to live with his sister and her husband and her daughter in a town called Kovno, Lithuania, saying they would be safe. He would be safe there. His father went there. The Nazis took the town a few days later, and afterwards they killed all the Jews. So my father kept that secret all of his life. He married my mother in the late 40s, moved to Denmark. She was Danish. My mother was in the Danish resistance, hid Jews in her apartment in Copenhagen. They had my sister and I baptized in a Russian Orthodox church in Copenhagen in order to keep his Jewishness a secret. I was baptized Ida Maria Judith Borunski, and it was many years later, after we'd come to Canada, he marched us off. We lived in Sarnia, Ontario. He marched us off to the Lambton County Courthouse. He had our names changed. I went in Ida Maria Judith Borunski and came out Judy Darcy. And he kept it a secret until a few years before he died. And so I talked about it with my friends after he had shared it with us. But he walked into Holy Blossom Synagogue, Holy Blossom Temple in Toronto in his mid-80s, met with the esteemed Rabbi Gunter Plaut, wanted to atone for having denied his history and his heritage, and then he started telling his family. And after he died, we found a video that he had taped for the Steven Spielberg Foundation, the Shoah Foundation, that told us more about his history. And I was moved to begin telling his story last year when anti-Semitic and anti-Muslim posters, pro-Nazi posters, appeared on a church in New Westminster. And we were just, and this is the story I told in the legislature today, with 40 Holocaust survivors assembled there, all of them aging. It was very moving, and it was really just telling his story, but also talking about the importance of us coming together, of telling our stories, and of building bridges, and of affirming that good people will stand up against all forms of hatred.
I have to say, Minister, that I've read a lot on it, as many, many people have, and you've seen movies about it, but the thing that in a small way brings it home to someone this removed from it is the kind of personal story you tell. So I commend you for telling it. I think once you see that it's a person, and you have a personal story that goes with it, and one that's both moving and tragic at the same time, I think that has a greater effect. So thank you, and thank you for telling it twice today, because I know you had to do it at the legislature today and doing it tonight. We'll go back to your show, to your ministry. And Andrew McLeod of the Tyee has a question about measuring success. Here's Andrew.
The government has argued that your ministry was needed as a way to have one person who is responsible at the cabinet table for mental health and addictions, somebody who gets up every day and thinks about that. I'm wondering, as you look ahead, say a year, 5 years, 10 years, how will you measure that success? How will you know that you've made a difference on this file?
Well, on the overdose crisis, I wish I could tell you when it is we're going to turn the corner. What I do know is that we are escalating our response every day. We have more safe consumption sites, more overdose prevention sites. We have tens of thousands of naloxone kits out there, 1,000 locations where you can get them. We are connecting more people to treatment and more quickly. The number of people who are prescribing opioid substitution therapy, safe alternatives to street drugs, to poison street drugs, is up by 60%. The number of new patients who are on opioid substitution treatment is up by about 126%. Nurse practitioners now, I was really excited to make an announcement last week, nurse practitioners are now going to be able to prescribe life-saving medication. So we are escalating our response every day. Thousands of lives are being saved, but this is a very, very complex crisis that is sweeping North America, and we're just going to keep pouring it on until we turn the corner, until we start bringing that death toll down. In the ministry at large, I would say we need to get to a place in this province where people living with mental illness or addiction are treated with the same dignity and respect and have the same access to quality care as people living with any other kind of illness. So I think that's an important way to measure it. I think the other thing, some of the things that I referred to earlier, we need to get to a place where you ask once and you get help fast, and where every door is the right door. And those are really the words, I think, that summarize having a seamless and coordinated system where there isn't the same stigma attached as there is now. There's been a lot of great work done to overcome stigma, but there is still huge stigma around mental health issues, and especially about drug use, even more so about drug use, which is one of the reasons our government has undertaken this really significant anti-stigma campaign in partnership with the Vancouver Canucks, really trying to convey that this is not a strictly downtown east side problem. This is something that affects our brothers, our sisters, our mothers, our neighbors, our friends, our hockey mates, our co-workers. And we really do see that when we see the numbers of people who are dying and the whether they're middle class professionals or people who are homeless or people who are on hockey teams or co-workers. This affects everybody across the country, so across the province. So tackling stigma is really, really important, and conveying to people that these are real people. These are the people that we love. And why is tackling stigma so important? Because stigma prevents people from having conversations about the struggles that they're having with mental illness and addiction, and it prevents them from seeking care. So the more that we overcome stigma, the more people are going to be willing to have those courageous conversations and to access treatment and care.
You mentioned going to a federal provincial health ministers conference, and that Ottawa had asked you to lead off because of the unique nature of the BC ministry. Rob Shaw is a good question here about whether or not you're asking Ottawa for anything at the moment. Here's Rob.
Minister, there's been a lot of action to respond to the overdose crisis, and I'm just wondering, is there anything still left that you want to see the federal government do that could help save lives in British Columbia? And if so, what are some of the things you're asking Ottawa to help on?
Well, we've pressed them on a whole lot of things. Unfortunately, they've acted on some of those. They have speeded up the ability for people to be able to be licensed, to be able to administer Suboxone and methadone and so on. Those things that took far too long. They've just changed some of the regulations to allow some of the life-saving prescription medications that it's really critical that people have access to. People who aren't able to overcome their addiction with Suboxone and methadone. There are other prescription medications that previously you had to jump through so many hoops. They had to be provided in a hospital-based or a clinic-based setting. So they've loosened some of the regulations on that. They have committed some more resources than they had before. But we are certainly going to keep pressing them. I mean, our government has committed $322 million over 3 years. That's more than the whole country combined. So we will continue to press them to work with us on partnership, to open more doors, to allocate more resources. We are certainly the epicenter of this crisis, but these poison street drugs are moving across the country. British Columbia is at the leading edge, so it is absolutely true we have more people dying because there are more poison street drugs here, but we're also on the cutting edge of the changes that need to be made and of the escalation of the crisis. We're being bold and innovative every single day. The whole province, every other province can learn from it, the whole country can learn from it, and so we continue to ask the federal government to come in behind us in an even more robust way.
Good question from Bill Thielman here. Here's Bill.
Minister, I know that you're working very hard with your staff to try and find solutions. But if you could actually make one change instantly without any worries about the legislation or getting approvals or anything else, what would you change to make things better and to reduce the number of street deaths from drug addiction?
I don't think there's just one thing. I wish it were as simple as that. But addiction is very complicated, and there is an awful lot about our system of mental health and addictions that needs fixing. It is absolutely the case that there have been 16 years of neglect in the area of mental illness and addiction, and the mental health and addiction system is under the overdose crisis has really been a stress test for our system, and it has really revealed the inadequacies of the system. So we're working very hard to save lives every day, and we are saving a lot of lives every day. Unfortunately, 4 people a day are still dying. It is a big challenge, and we're working day and night to try and address it. When their life has been saved after an overdose, to connect them with treatment as soon as possible, to connect them with recovery, to connect them with the support services that they need in order to have a pathway to hope. Because if you save someone's life with naloxone and they go back to a precarious housing situation, or if they're still living in poverty, or if they are really struggling with trauma and mental illness and they need support for that, they don't have a pathway to hope unless we can connect them with those support services at the same time. So I wish there were a quick fix. I wish there were just one thing. But it's a number of different things, and that's why we're working on a whole lot of fronts at once. And I'm really excited about some of the things that we're doing across government that make a difference. So my colleague Selena Robinson, as part of our housing plan, Most of the projects that have been announced to address homelessness have also been projects that will involve housing that has support services for people living with mental illness and addiction, because the majority of people who are homeless are also suffering from mental illness and addiction. We're investing more resources in supporting youth aging out of care, because that's a group of young people that are at very, very high risk of addiction. And I think the greater investments we have in our schools of, teachers, more teachers in the classroom, but also we're going to be in the future putting more mental health professionals into schools. That makes a difference in supporting kids early, which we absolutely need to do. We need to intervene early when kids are struggling with depression or anxiety, with mild to moderate mental illness, before it turns into severe mental illness and before it turns to substance use.
You mentioned a few times the one door, and I was just thinking you told some powerful stories already about parents and family members and friends who were worried about someone who's vulnerable or fallen into addiction or fallen into opioid addiction and worried about saving them. Is the one door there? If someone's watching tonight and there's a member of their family or a child or that they're very worried about, is there a one door at least where they can start? What should they do if they're worried?
Well, if it's an emergency, they should call 911.
Sure.
If they want to know about resources that are available, they should call 811. We do have staff who have been specially trained on the 811 line, where they can call, and you can get information on stopoverdosebc.ca, resources about information about where resources are available, information about stigma, information about how to start a courageous conversation with someone who is struggling with addiction. There are a lot of very valuable resources there. That's also very much part of our campaign against stigma, to raise awareness that people who use drugs are real people and they are our loved ones and our friends. I can't say to you that in the system for mental health and addictions that right now there is one door, but we need to get to that place. We absolutely need to get to that place.
Tom Fletcher, Black Press. Good question. Here he is.
Your colleague, the health minister, is talking about primary care teams to provide for people who don't have a family doctor and have, in some cases, gone many years without a family doctor. Is that a solution for mental health care too? Can these primary care teams handle those issues as well?
The primary care networks that the Minister of Health is talking about are absolutely critical to the solution here. Both primary care teams are meant to be doctors, nurse practitioners, but also other people in the healthcare team, from physiotherapists to occupational therapists, nurses, but also mental health and addictions workers. So we need to be building robust primary care teams that include people who specialize in mental illness and addiction, and they need to be able to both support people directly and have places that they know that they can refer people to where they really will. And people in healthcare often refer to having a warm handoff, not just giving somebody a phone number, not just giving somebody a website where they can go, but actually saying, sitting down with you, learning what it is you're struggling with mental health, mental illness or addiction, and being able to say to you, this is where you need to be, this is the right program for you, and we're going to make sure that you get there. So these primary care networks are absolutely a critical piece of the solution going forward. And they're also about, so many people who are living with mental illness or addiction are not now attached to a family practice. So this, the plan from the Ministry of Health, the plan from our government is absolutely to have more people who are attached to a doctor, a nurse practitioner, but also an entire primary care team that includes mental health and addictions workers.
Take a brief break on Voice of BC with the Minister. One more segment. Stay with us. We will be right back.
As a Marxist, and eventually found that she wasn't going to get much done in that party and joined the NDP. She got involved in her union and ran for office and was defeated. But yet she got on committees, she eventually impressed people and rose to a leadership position in the HEU. When she first wanted to be an MLA, she ran for NDP nomination and she lost to Gregor Robertson. Yet she persisted. She came back. She got elected in 2013 as an MLA, and she now sits in cabinet. Some people say she was disappointed not to be Minister of Health and to have a junior portfolio. But it's not the first time Judy Darcy has faced a setback, and we can see she has a history of overcoming them. I'm sure we're going to see more from Judy Darcy in the years to come.
Hello, I'm Mary Polak, the Opposition House Leader. Forget about Netflix. If you want good television, tune in to Vaughn Palmer on Voice of BC.
Help me run.
Help me go places.
Help me swim. How we give hugs.
Judy Darcy has a lot on her plate as one of the busiest ministers in the NDP government for mental health and addictions, but when Premier John Horgan was looking at picking his cabinet, he saw someone with a ton of experience in the healthcare sector who is more than up for the job and who has been doing what she can to handle issues like the overdose crisis and many other items on her plate so far as minister.
And welcome back to Voice of BC, and we are trying to spread the word about the new ministry and what it's doing. Lots more questions to be asked of Judy Darcy. Here's Jane Stirk, former leader of the Green Party.
Minister Darcy, it's important, I think, that there be a balance between prevention and acute care. In our medical system, we see almost all of the dollars going to acute care. But in the mental health field, we really do need to deal with issues like poverty, colonialization, racism, lack of income, lack of education, to ensure that the next generation of children don't grow up to have mental health problems. How are you going to achieve that balance?
We're already working on exactly that. So let me talk first about Indigenous people. I mentioned already that Indigenous people are dying at a rate 3 times the population at large in the overdose crisis, and that is totally about our dark history of colonization, of residential schools, of racism, and intergenerational trauma. And so much of addiction is actually rooted in trauma of one sort, whether that's childhood trauma or whether it's intergenerational trauma for Indigenous people. So we're working in very close partnership with the First Nations Health Authority. We're also beginning some work with Métis Nation, BC, and with the Association of Aboriginal Friendship Centres. But in particular, with the First Nations Health Authority, we're supporting them in creating 55 community projects that are really nation-driven, nation-based, community-driven, that are about overdose prevention, that are about harm reduction, but that are very much about connecting to the land and culture and healing and combining traditional healing with Western medicine. So it's a very close partnership, and that for us is really about reconciliation in action. They're also talking to us and the federal government about a 10-year plan for mental health and wellness. So we absolutely believe that this is that we need to be addressing those historic roots of the problem, and I'm very proud of the work that our government is doing that is starting to get at what is referred to as the social determinants of health, but the social conditions that both lead to poor health and that lead to poor mental health and that can lead to addiction. So we created a minister responsible for poverty reduction. Minister for Social Development is also now responsible for poverty reduction, and we will have legislation and targeted goals and timetables for reducing poverty in the province. I've spoken about homelessness. When we are creating homes for people who are homeless, we also need to be giving those kinds of supports. But speaking of prevention, that's exactly what I was touching on earlier, Vaughn. We need to get into our schools. We need to start early with our kids. We need to give them the supports they need at that crucial time. Kids these days are under incredible pressure compared to our generation. We need to support them early. That's absolutely about prevention. And one of the models that we really support, and we've been expanding support for, and we're going to do more of that in the future, is something called the Foundry Youth Hub, which is a really remarkable model that sort of speaks to what the future could look like for mental health and addictions. There are about 5 or 6 of these already in the province, and we're supporting them as a government. It's a one-stop shop for youth at risk, ages 12 to 24. You walk in off the street, you might have a health issue and you don't want to go to your family doctor, who is your parents' family doctor. You may be struggling in school. You may be struggling with depression or anxiety. You may realize that you're struggling with substance use. You walk in off the street, you get to see somebody right away, and then you get connected in that place with all the supports and the services that you need. And I have seen and I have met with the young people who are now working as peer support workers in some of those Foundry Youth Hubs that are in turn making a difference in the lives of the youth that are coming in the door now. And that's really what we mean by, prevention, one-stop shop, coordinated care, and it's working really well in the communities where these Foundry Youth Hubs already exist. And we're certainly going to be supporting the expansion of youth hubs like that across the province because we need to start early.
Can people find where these are through your ministry's website?
They absolutely can, and they can find them. If they Google Foundry, they can find them as well.
Oh, good. Christina Winter, now of the Green Party. Another good question. Here she is.
Minister Darcy, the federal government has recently announced that it is easing access to prescription heroin in order to allow Canadians suffering from opioid use access to the drug and addiction clinics. The confidence and supply agreement with the BC Greens prioritizes an immediate response to the fentanyl crisis based on treatments just like this, welcomed by BC doctors as a way to save lives. How does your ministry plan to support the expansion of this evidence-based treatment to opioid users across British Columbia?
Well, I actually just had a meeting today with people who are heading up our Overdose Emergency Response Center in British Columbia. We created an Overdose Emergency Response Center because we said this is a public health emergency. We need to treat it like that in every way. So it's headed up by some really key people who know about both addictions and who also know about emergency responses. And meeting with them and the Ministry of Health, we are rolling out access to injectable prescription medications. Excuse me. And that was precisely the conversation we're having today. We're working with health authorities in order to expand access to those life-saving medications.
Coming up later this session of the legislature is a big piece of legislation, a couple of them actually, that will be the provincial share of the federal plan to legalize marijuana this summer. And the province is doing a lot of the work. It wasn't necessarily the NDP's idea to be doing this year, but here they are doing it. There's a whole lot of questions that could be asked about it, but here's an interesting one from Jordan Bateman. Here he is.
Minister, very soon marijuana will be legalized in Canada. Some studies say that as many as 30% of marijuana users have what's called a use disorder, things that could range all the way up to addiction to marijuana. I'm wondering, what is your department doing to get ready for marijuana legalization? And do you think that without the threat of jail for users, that perhaps we will actually start to get hard numbers, real numbers, on the number of people who are addicted to marijuana?
Well, it's a very good question. And the BC Centre for Substance Use, which is a really, excuse me,
it's okay,
which is a centre of excellence for addictions in the province of British Columbia, really a leading in the country, are actually working on the issue of addictions to marijuana so that we can be ready. So it has been the Solicitor General, the Minister responsible for Public Safety, who has been leading the implementation of the federal government decision around this issue. But it's certainly something that we are preparing for and that the BC Centre for Substance Use is working on.
We'll go to Bruce Halser. This is another issue that you hear. It's interesting. In the job that I have, I do this show on a newspaper, talk to a lot of people. Politicians hear these questions too in the media, hear these questions again and again from people, and I'm always looking for a definitive answer from somebody who's actually in the position to do something about it. So here we go. Bruce, decriminalization of all drugs. Here he is.
Minister, you're on record as criticizing the Trudeau government for only decriminalizing marijuana when you think they should also decriminalize harder drugs. Are there any drugs that you think should be illegal, or do you think all drugs should simply be regulated for health purposes?
I don't think he's quite quoting me the way that I've spoken on it before, but I mean, decriminalization is a federal government issue. We're pushing the envelope in the British Columbia context to provide people with access to all of the life-saving prescription medications that they can have access to, and that includes prescription hydromorphone, prescription diacetylmorphine, and so on, in addition to Suboxone and Methadone and other, Suboxone being the first-line treatment. There's been a lot of discussion in Canada, and I think we need to have a courageous conversation about things like the Portuguese model. But there are things that people...
Portugal... Everything is legal?
So they didn't legalize it. And there's an important distinction between legalization and decriminalization. What Portugal did was decriminalize possession for small amounts of drugs for personal use. But they didn't just do that. What they established was something called dissuasion panels, actually. So if you're a drug dealer, if you're a big-time drug dealer, you're busted, you go to jail. If you have a small amount of drugs in your possession for personal use, you go before a dissuasion panel. And that includes people who are experts in addiction. And you are offered the opportunity to get into treatment right away. But not only that, and this is the piece that people know very little about, they have developed extensive wraparound services to support people living with addictions. And I met with the head of the drug directorate. We spoke at a conference together last September, the head of the drug directorate in Portugal. And he told me how they approached all of these employers and how many employers came forward and were willing to hire people who were living with addictions, understanding they were undergoing treatment. Some of them were in long-term recovery. Some of them were on, substitution therapies, life-saving medications. And they were willing to offer them employment. They worked with people to find supportive housing, to find counseling. So it's really about those kinds of wraparound services, because we need to treat people who are living with addictions as if they are dealing with a health issue, not treat it as a moral issue, treat it as a health issue, and really address all of the circumstances in their lives. That's what the Portuguese have done. I think we need to have a courageous conversation about that in Canada. And I have to tell you that a lot of the police that I talk to, all of the police that I've met with, have said, we're not going to arrest our way out of this crisis. The people who work in law enforcement these days absolutely recognize that we need to treat this as a health issue, and they're totally on side with us working, building partnership between the criminal justice system, law enforcement, and health and social services in order to really provide people with the supports that they need so they can get on a pathway to hope.
So what I'm hearing you saying is that the whole country would have to do this together, obviously. It's not something one province could do.
It absolutely can't. It's a federal government issue, and they've said that they're not going to do it.
But the other thing that's clear from what you're saying is that you have to have that whole program, all the wraparound there in place. You don't just change the law.
Absolutely.
And that probably would be the biggest commitment. But perhaps some of the things you're doing in BC can point the way to a larger and more ambitious program for the whole country.
I think they can. I think they can. And when we see that when we're, the homes that we're creating for people who are homeless, we're ensuring that there are wraparound services there for people living with mental health and addictions. If you look at the other things that we're doing to tackle some of the social conditions, we absolutely think that these things need to go hand in hand.
We got time for a couple more questions. Let's go back to Andrew McLeod of the Tyee.
So far, the government seems to be focused on harm reduction and the treatment of addiction. When doctors like Gabor Mate talk about addiction, they talk a lot about the psychological roots of it, the effect of trauma and that sort of thing. I'm wondering what, if any, plans the government has to address those roots of addiction.
Dr. Gabor Mate has done really remarkable work, and I'm a big admirer of his work. And he and many other people have talk about trauma and adverse childhood experiences really being at the root of addiction. And there has been tremendous amount of research and a lot of evidence that that's absolutely the case. And that's why we really need to put in place those kinds of programs for early prevention and early support. And we need to ensure that everyone who works in the field of mental health and addictions also is providing what is referred to these days as trauma-informed care, and that we understand that trauma really is at the root of so much of the mental illness and so much of the addiction that we're seeing in our province and in our country today. And certainly when you look at what's happening with Indigenous people, there is absolutely no question that the suicide rates that we're seeing, the suicide epidemics we've seen in some Indigenous communities, and the rate of deaths by overdose, which are 3 times the population at large, that is absolutely about intergenerational trauma. And that's where, working in partnership and really reconciliation and action by working in partnership on mental health and addictions is a central part of the work that we're doing.
Ida Chong, again, former cabinet minister, raising an issue about housing, and here she is. Oh, okay. Well, Ida has disappeared from our list of clips, but I can ask her question because you've already mentioned housing as a support for mental health and addiction. So let's talk about what can be done and is being done already about it, and how it overlaps too with the problem of homelessness.
Well, I've mentioned already that the majority of the people who are homeless are living with mental illness and addictions. Mm-hmm. And it's, there are things that happened in their lives, that a downward spiral that ended up with them living on the streets. That means that when we need to provide homes for them, there's nothing more fundamental than people having a roof over their heads, someplace to call home. It's very basic to your sense of security, and it's fundamental to you having some sense of a pathway to hope. So we're being very aggressive in putting in place initially these modular homes in many communities across the province, including in New Westminster. Just this week, we've announced that there's going to be a unit of 40 homes that are created in New Westminster. Now, in that case, it's specifically for women who are most at risk, and sometimes for women who are fleeing from domestic violence. But again, all of those homes and those housing projects that we're putting in place are going to have attached to them the support services that people need in order that they can rebuild their lives, potentially find jobs, find meaning in their lives again, and really hopefully connect them to services and to treatment and to recovery.
The Housing Minister, Selena Robinson, was on the show a little while ago, and she talked about modular homes, and you hear the name and it doesn't quite tell you how innovative this idea is. So you want to Google them or something and look at it, because she talked quite enthusiastic about how quickly these can be put together,
Absolutely.
how fast they are, how handy they are, and how innovative they are. I think we have time for one more question. Well, we'll see how we do on this. Bill Tillman, we talked about the fentanyl flooding into British Columbia and why we're on the cutting edge of that as well. Here's Bill with a question about it.
Minister, one of the things that we know but doesn't get talked about much is that it seems from law enforcement and others that most of the fentanyl getting into street drugs comes from China. What steps should be taken to ensure that China and Chinese authorities are stopping smuggling of fentanyl into British Columbia, into Canada?
Well, I know that this is an issue that the Premier has raised with the federal government, and it is the federal government's responsibility. We have certainly invested resources in the province in strengthened law enforcement and joint task forces in order to both try and stop this stuff from being shipped into the country, as well as really focusing on arresting some of the bigger drug dealers, and public safety and Solicitor General, various police forces are actively engaged in that. But it's also really important to understand that this stuff is really hard to get at. Fentanyl, a police officer explained to me that a teaspoon of salt, the granules are smaller, a teaspoon of salt has about 2,000 granules in it. just 2 or 3 granules of fentanyl can kill you. So, and one of the reasons that people are dying at the rate that they are, is that there are people who have these illegal pill presses. And if you mix the ingredients improperly and there's too much fentanyl, that ends up killing you. So that's one of the things we're going to be acting on as well.
And on that chilling note, I will thank Judy Darcy for coming on the show, telling us about our new ministry. Check out the website and addiction fighting. And thank you for watching Voice of BC, bringing the legislature into your living room. Good night.
The following is a community access program.